Hello.
Hello.
I'm Christopher Hoover. I'm going to be your nurse for today. Can I see your wristband?
Sure.
Can you tell me your name and date of birth?
John Gabbard, 20 September 1972.
All right. How's it going, John?
Good.
Good. Are you having any pain?
Just a little bit after the knee surgery, so that's to be expected.
I see. Do you know where you are today?
Yeah, I'm in the hospital.
Okay. And do you know what day it is today?
Today's Wednesday.
Okay. Awesome. I'm going to raise the bed so I can get, so I don't hurt my back. So are you taking any medications?
Yeah, I got some narcotic medications that I've been using to help control the pain.
I see. Is it working?
Yeah.
What's your pain level in your knee?
About a 3.
What's your tolerable level?
About 5.
What kind of pain? How would you describe the pain?
It's a little achy. Sometimes if I move a little bit, it gets a little bit sharp, but it's not bad.
Okay. All right. Well, I'm going to do a head-to-toe assessment on you. I'm going to start with your head, and I'm going to work down to your toes.
Okay.
All right. I'm just going to inspect your head real quick. And then can you look at me? Good. Good. I'm going to palpate I'm going to touch your head. Just let me know if there's any pain or tenderness.
Nope.
Do you feel that on each side?
Mm-hmm.
Okay. Tell me if you can hear this.
Yep.
Does it sound about the same?
Yep.
That's good. Alrighty. And can you smile for me? Okay. Can you raise your eyebrows? Squint your eyes. Stick your tongue out. Side to side. Okay. Alrighty. I'm going to shine a light in your eyes.
Okay.
First, I'm going to see. Alright, so about 3 millimeters is the size of your pupil, which is normal.
Okay.
Right. So if you could just look straight ahead, find a place on the ceiling. Alright, and here we go. Okay. Now if you could follow the tip of this pen. Alright, good. Alright, can you open your mouth for me? Say ah.
Ah.
Okay. And then smile. Okay. Good. Have you had any problems with smelling or tasting?
No.
Alrighty. Okay, move your head side to side for me. Good. Put your head to your chest. Look up. Any pain with that?
No.
Any tenderness? Okay. Alright, I'm going to listen to your lungs next. So I'm going to start with your with the front side of your body and hear the lung sounds there.
Okay.
And I'm going to listen to your heart, and then I'm going to listen to the lungs on your backside. Okay. Alright, breathe. And one last breath. Okay. Now I'm going to listen to your heart. You had any heart palpitations, any problems with your heart?
No.
Okay, any trouble breathing?
No.
All right. I just need you to lean forward if you could for me.
Sure.
So I can listen to the lungs on your backside. Okay. All right, breathe. Okay. All sounds good. You can lay back down now. All right, next I'm going to assess your abdomen. I'm going to inspect it first, see if I find any abnormalities, masses, discoloration, scarring, scratches, anything out of the ordinary.
Okay.
All right, and that all looks good. All right, now I'm going to take a listen to your stomach, your abdomen. Have you had anything to eat or drink recently?
Oh, yeah, I had breakfast this morning.
Okay. Around what time was that?
Around 7 this morning.
Okay. Alrighty. When was your last bowel movement?
That was this morning.
Was it normal?
Mm-hmm.
Normal for you?
Yep.
Okay. And have you urinated yet?
Yeah.
Okay. Any problems with the urine?
No.
All right. Good. All right. Now I'm going to take a look at your knee. So, I'll look at the bandage. So I'm looking for discoloration, excess blood, purulent discharge, making sure the bandage is secured. And then I'm looking for any swelling, redness. I'm gonna feel it for heat, so it's normal. And then I'm gonna test your sensations to make sure that you still have feeling to all your areas. So I'm gonna go right down your thigh and down to your feet.
Okay.
Just let me know if you feel that.
Okay.
Does it feel about the same?
Mm-hmm.
Okay. Good. All right. Can you raise your left leg for me?
Sure.
Alrighty. And try your best with your right leg.
Yeah, okay, yeah.
Okay. Good. All right. Now, if you could bring your feet up. Press on the gas pedal. Okay. Alrighty. Now I'm gonna check I'm gonna squeeze your toes. Just checking for circulation.
Okay.
Good. Good. Check your fetal pulses. Good. Nice and strong and equal. Ready. Just gonna look at the back of your foot, make sure there's no sores or anything developing. Okay. Good. All right. Now I'm gonna take a look at your upper extremities. So if you could just lay your arms to your sides. Let me do it from the your side. Okay. So, just gonna squeeze your arms down. Let me know if there's any pain or tenderness.
No, feels fine.
Does it feel even on each side?
Mm-hmm.
Okay. Just gonna squeeze your finger. Good. Now can you bring your arms together? All right. Up, over, and then out. All right. Now bring your arms close to you. Push against me. All right. Now pull it. Good. And I want you to squeeze my fingers. All right. Good. Alrighty. So is there anything else I can get for you?
No?
Okay. Is there any way I can get you to roll on your side so I can take a look at your back?
Sure.
Okay.
The head bent down a little bit.
Of course. Okay. So, good. So that's all good. Back of your head looks good. All right, go back on your back, and can you roll on your other side?
Sure.
Let me know if you need help with that. It's okay. Good. Alrighty. So is there anything I can get for you, John?
No, doing pretty good.
Alright, well the call bell's right over there. Call me if you need anything, especially if you have any increased pain. And I'll be back to check on you, okay? Great. Lower your bed. I want you to break your neck.